As I tell everyone, everybody does it perfectly when they first start. Most men do it twice daily. That is not a rule. That is not written anywhere. No, sir, do not do that. You will not get good levels utilizing the top like that. They just said, Doc, after not being on it for a while, I started feeling just like I did before I started. That's not how testosterone works in a mature, intelligent man. I just feel great, but man, I don't have any symptoms. I feel great. Maybe if I raise my levels, I'll feel greater. Well, when does that end? Great to greater. Now you're greater. Are you going to be greater? I mean, there's a plateau to the feel good effects. Okay.
I want to ask you about this because, even myself have wondered in the past, do you reach the saturation point in the scrotum where it stops absorbing as well? And is this daily, every other day ritual shaving one way to mitigate that? Or even if you do that, does something happen to the nature of the skin cells where they're not taking it up like they used to?
No, sir. No, sir. I've never seen that in clinical practice at all. It doesn't stop working. You don't stop absorbing it. Not at all. I've never seen that happen. Now, look, some absorb it better than others. Well, that's a given. That's why we start with a dose and measure levels later. Some men need different dosages to get the same results. Some men need more. Some men need a lot less to get the same results. But shaving will make that difference. There's going to be several times a year that I'll see a man and his levels, let's just pick a number, 1,500 the year before that, just in the same ballpark. And then all of a sudden he comes in at 900. Okay, well, Doc, my levels drop. Okay, Bill, well, let's go through why that may have happened. Did you apply it correctly before that? Yep, sure did. I applied it 5 hours before, like you told me to. Applied it the night before. Did everything you've been telling me to. It was dry, blah, blah, blah. All right, well, when I see it drop by 400 or 500 points, Bill, what typically has happened is a man has stopped shaving regularly. What about you? Ooh, yep, Doc, you got me. Yep, I maybe shave once a week now. Look, as I tell everyone, everybody does it perfectly when they first start. When a guy first starts, he'll do everything that you tell him. At least 99% of them will. Exactly how we're going to tell you to do it today or reveal how to do it today, they will do. So their first labs that they get, man, they're always gorgeous and beautiful. Those are your best labs, doing it the most correct way. If you deviate from what you did to get those labs, well, the labs are going to change. It only makes sense, Mike. I mean, if you don't apply it consistently, if you stop shaving when you were shaving before, well, the labs are going to drop. So what we've talked about so far is that, I'll start with the 2 clicks, the clean, dry, shaven scrotal skin. All right. I will tell men, you don't have to shave if you don't want. If you're totally adverse to shaving that area, I can still make it work. It just means we're going to have to use more to get the same results. I always tell men, before you put that top back on, you can see the bottom of my top, very clean. Take the 2 little fingers and gently press on each side of that little opening. Little pea size is going to come out. Don't press down real hard, just gently help it out. Because if you ever see any cream caked in the bottom of your top, that means what I pressed out gently just came out on its own due to the pressure. That means you didn't get your full dose. So I recommend that guys do that little gentle press. So it's click, click, swipe, apply, gently press, swipe, apply, then put your top on. If you see any white residue in your top, you didn't get your full dose.
I noticed you wiped the top with your 2 fingers and then applied to the scrotum. And I know part of the beauty of the toppy click, I guess it's for other areas of the body as well, was that you can click, and apply.
No, sir, do not do that. No, do not do that. You will not get good levels utilizing the top like that.
Really?
You'll get levels to come up, but nowhere near using your 2 fingers. And I'm glad you picked up on that
Yeah.
because that's why I tell them, look, when I tell you what I'm telling you now, it's how to absolutely to get the best levels of testosterone. Once again, anybody can deviate from what I tell them, but their levels probably will not be as good. And yes, there have been men that levels came up, but not as expected. And when you've got into further questioning, they were using the top of click, they were using the dispenser top, they would do it and then use their dispenser top to rub it on. It didn't work near as well. In fact, I have a physician colleague that did it. And he said, I mean, his levels doubled. They were 700 using the top. They were 1,500 using his fingers.
What do you think it's about the fingers? I'm trying to work out what the
You're just
mechanism.
rubbing it in. I mean, think about it. When you apply your sunscreen,
Okay.
when you apply
Yeah,
sunscreen to
yeah,
your
yeah.
face, do you squirt the sunscreen in your face and use the top of the tube to rub it in? It just is not going to get absorbed like that. You can use your fingers to rub it into the entire scrotal skin and surface, and it just really gets absorbed well. So apply it. So we're going to use your two fingers to apply it. You're going to go click, click, swipe, apply, or whatever. If your doctor says do one click, then do one click, swipe, and then gently press and then apply. Then wash your hands. All right. Okay. They really need to avoid bathing, showering, or swimming for at least 4 to 5 hours after you apply it. We don't want to wash it off before maximum absorption occurs, and that typically is going to occur within 2 to 3 hours. That's why I say 4 to 5 to make sure they keep it on there for at least that
Swimming,
2 to 3 hours.
showering, bathing. What about exercising and the
It's
gym and
okay to go
sweating?
exercise afterwards. It actually will increase the rate of absorption due to the vasodilation that occurs. So, but if somebody has to do that every now and then, it's not going to hurt their results at all. Okay. But if you get into a habit of doing it too often, yes, it's going to have a negative effect on your results. But if you have to shower or bathe every now and then within that time frame, you're not going to notice any difference in how you feel or function at any time.
Should they reapply? Should they reapply after swimming and showering?
No,
If no.
no, 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 no. Then you're going to run out. And because it's a controlled substance. You don't want to use more. You're just not going to feel any different. I find that kind of amazing. In that men will talk about. I think you mainly see it on forums or on internet and Reddit or whatever you want to say is that men act like if they miss one dose, they're going to notice an effect. It does not work that way. Hey, Mike, have you ever missed a dose of your testosterone?
Sure, of course.
Did you notice?
No, you
I
no.
mean, I didn't either. I'm going to say it this way. I've never said it on the podcast before. I'm going to say it right now. Whenever we first give men testosterone that have had symptoms of a deficiency for whether it be years, they do not notice those symptoms resolving after the first injection. Okay, it's like you take a testosterone injection, you apply the cream one time, boom, you've 10 years of feeling bad with low testosterone levels, or 5 years or 2 years, just don't go away. And guess what? By the same token, missing one dose, you're not going to develop all the symptoms of testosterone deficiency. That does not work that way. It doesn't work like insulin in your blood sugar. So I find that we've all had to stop it for one reason or another, or forgot it, or lost it, or various reasons. And I see men all the time that have to stop it due to their wife gets cancer, or they're in a major automobile accident, or something happens where they have to stop it. And none of them have ever said, "Hey, doc, I decompensated. I ended up in a fetal position in a corner, crying." And that's not how testosterone works in a mature, intelligent individual. They just said, "Doc, after not being on it for a while, I started feeling just like I did before I started."
It's very gradual. And do you think the reason why is because, once the testosterone receptors are saturated, because you've been on it for so long, then it's not going to switch off as soon as you miss that dose. Is that one of the reasons why?
Well, I mean, yes, of course there's. Well,
They're
hopefully,
activated, saturated, and they're activated.
but it's just that we don't develop those symptoms of a deficiency with missing one dose.
Yeah.
Just by levels dropping, you're not going to notice those symptoms of deficiency.
What about over a
So
few days? Let's say there's an
that's,
issue. Yeah.
I think it's going to take a matter of weeks
Weeks.
and months. It really is. And everybody's going to argue, "Oh, I didn't take mine and I noticed it." Look, if
Very
I could do an
psychological.
experiment
Yeah.
with those men, it is because
Yeah.
I could give them a tube of testosterone, or we could just inject testosterone cypionate and then use a placebo that looks the same. I would love to run that experiment because we've kind of run it individually in our clinic. But in these men that want to claim that, I guarantee you, if I just switched it out and they didn't know what they were getting, they wouldn't know for a period until a
Period of time.
couple of weeks,
Yeah.
then they would know. But you're not going to know it after a day or a couple of days. You're just not going to. It just, once again, you don't get symptoms of deficiency by missing a dose or missing a couple of days, and you don't resolve your symptoms of deficiency by just getting a dose for that day or a couple of days. It just doesn't work that way. And I see it clinically all the time. All the time. Men will run out. They'll just forget to renew their prescription. They'll just run out. And they'll run out for a week or two, and they just say, Doc, I won't do that again. I ran out.
Yeah.
Once again, there's not what you would read on forums or the internet when you're dealing with a mature, intelligent population of men. It
That's
just doesn't
good.
work that way.
No, that's interesting. And these are some of the questions I think people have, and I think it's really good that we address them. We've been doing this for a long time, since
Right.
2016, using the creams in some subset of patients, and we kind of run into the same things here. And it's important for people to be reassured that
Right.
just because it's run out, you're not going to go back to the hypogonadal state, because people forget, even if they see a slightly lower level on the blood test, that when you're on your own, under your own steam, under your own testosterone, and it's
Right.
deficient, you're always like that. But one blip on a blood test does
Yeah.
not mean, if you were to measure the area under the curve all the other times, you have more than enough testosterone
More
compared
than enough.
compared to where you would
More
have
than
been
enough.
before.
Right. What we see clinically, I'm sure that you do, is not what you read on forums and
Yeah.
internet. What you see in a clinical practice, we don't see those men with all these complications. I don't see a man any day of any week of any year with estrogen symptoms, for instance. We don't see those. Yes, we all see hair loss, we'll all see acne here and there, but the side effects from testosterone are not very common. The most common are going to be acne and hair loss, things like that. But we don't run into our days are dealt with our days are with dealing with men that are having improvement in their parameters of health and in their symptoms of a deficiency, not dealing with problems like these guys on the forums and the internet. So missing a dose or two, you're not going to notice
Mm.
at all. And so when we go into the cream, we talk about that. All right, so you asked some men, most men do it twice daily. That is not a rule. That is not written anywhere that it should be done or has to be done twice a day. That's just what I have found works best for most men from a clinical standpoint. When you hear me make the statements, most men, I'm not saying every man. I have a few men that only do it once a day and they feel just perfectly fine doing it once a day. And these are the three reasons that I get for doing it once a day. Doc, my schedule's really crazy. It's busy. I'm working two jobs. I'm just, I want to do it twice a day, but I forget so much and I'm usually out of the house, for 16
Yeah.
hours. So, but I feel really good, by the way. Can I just keep doing it once a day since I feel so good? Yes, you can. Reason number two, Doc, I have no problem doing it when I get up in the morning. That's easy. I'm going to go to work. But look, I don't want to have to worry about it a second time during the day. You know what? I'll just admit it. I'm just too lazy to want to have to do it twice a day. Guys have really said, I just don't want to have to worry about it. I admit it. I'm just too lazy, but I feel good. Then okay, keep doing it just once a day. And then the third reason is a lot of men have a great deal of fatigue and the testosterone is really giving their energy back. And they complain that when they apply it in the evening, that it tends to interrupt their sleep.
Mm.
And so they just
Okay.
feel better doing it once a day. So that's perfectly fine to do it. You just have to, once again, raise levels to avoid symptoms. I mean, to resolve symptoms and avoid unwanted side effects.
Yeah.
It doesn't have to be complicated because it's not complicated. It's a very simple process. It is a very simple process that is made complicated by those that have a financial gain off of making it complicated, but it's very easy. So we've applied it twice a day, avoiding bathing, showering, or swimming for at least 4 to 5 hours
Right.
after applying it. Uh, if they miss a dose or forget a dose, and I tell them all the time, don't worry about it, don't stress over it. You won't feel or function any differently. You don't need to double up at your next dose. Just pick it up where you left off. All
That
right.
sounds right. Well, what about having, I don't know, having sex with your partner? Should
Well,
you?
let's go.
Yeah.
Yeah, let's go through that. Okay, so we've applied it twice a day. We're keeping it on there as long as we can. Okay, there's only one potential downside of the cream compared to injections, and that is the potential for transference. Now, of course, transference does require skin to skin contact.
Yeah.
Now, we use that scrotal application, Mike, for two reasons. Number one, we typically get our best levels applying it to the scrotal skin because it's thin skinned and highly vascular. As I have said before, you can apply this cream anywhere that you have skin from head to toe, face, chest, shoulders, inner thighs, top of the foot, anywhere they have skin. It'll work. But the scrotal skin will typically give most men their best levels, but more importantly, it reduces our risk of transference.
Well, I
So
was.
since, since transference requires skin to skin contact with a scrotal application, we should have completely eliminated any risk of transference to children or
Yeah.
animals. So we're talking about our sexual partners. How do we avoid transference with them? Four ways. Number one, Wait 5 hours or longer after you apply it to have sexual activity.
Okay.
Number two, just wait till after sexual activity to apply it. That's so easy to do. It's what I do. Number three, at any time after you apply it, you want to have sexual activity and reduce any risk of transference, simply go into the restroom, take a towel, soap, and water, wash off the application site. And then number four, many people, many couples, due to kids or their schedules, are very scheduled with regard to their intimacy. If it happens to be that night or nights that it's always going to occur, and you don't want any risk of transference, you simply don't have to apply it at all. You once again will not feel or function any differently. And then there's a number five, but it's not. Anytime you start applying the cream at night, you should sleep with some form of clothing on your lower half, so as not to have any, chance of any sustained skin-to-skin contact with your significant other and be sleeping over with you.
I mean, there's also the consideration that women also produce testosterone, and how much transference would there be? I used to make the joke, I don't know if it's just quite crude, that unless you take the phrase going balls deep literally, maybe you won't actually get the transference that you think.
Yeah, it's wonderful that you brought up that story. I haven't mentioned this in a long time, and once again, I failed to mention it when I talked about this with Stephen Devos, Dr. Devos. But look, I treat many couples. I treat men and women. I'm not just a men's clinic.
Yeah.
I treat just as many women as I do men. So many of those couples are both on testosterone. We know that. And many of those couples come back and say, look, doc, we don't take any precaution anymore. And I don't tell them not to. They just, we don't care. We blah, blah, blah. And so I'm not seeing any significant issues with transference in those couples for the exact reason you just mentioned, because there's not a lot of sustained skin to skin contact with that scrotum, even during intercourse.
Yeah.
All right. So, but still, once again, we tell them how to take precautions, and that's how you do it. And the way you would know if your significant other was typically getting too much without measuring blood levels, you just simply, they would probably complain of some acne, maybe getting some pimples they normally didn't have, or maybe some increased hair growth. That's how you would normally see it. We don't really see it as a part of my clinical practice. Once again, I don't treat typically men under 30 unless they have a diagnosis of hypogonadism. And the only reason that is that it's this reason, is that age group would rather get their information from Reddit and the forums, and rather than truly follow evidence-based medicine. And sometimes following evidence-based medicine runs counterintuitive to what they think makes sense, like the whole estradiol management issue. What the medical literature actually shows and what actually works is counterintuitive to what seems to make sense to them.
But for younger patients, I just, with all the talk of environmental toxins, and we're seeing younger men complain of symptoms of low testosterone. What did Jay Campbell mentions, like the soy babies or soy boys,
Right.
and I mean there might be a growing group of patients that are you seeing them come to your clinic? Because we're seeing younger and younger.
There is a dramatic need. They are a poisoned group of men that has a big need, but once again, it's not that they don't have the need. There's plenty of middle-aged and older men that need all of our help. They are a budding population of men that are sick and poisoned, and as I've said, by the toxic environment that we are in, and that they have been exposed to since being in utero. The problem with treating that group of men is the difficulty because of the social media presence, and they would rather get their information from like I say, Reddit or Excel mail than from what you're trying to teach them and tell them. Whereas the men that are 40 and above or so, they'll doc whatever you say. I mean, they'll do a little research, but they kind of can understand evidence-based medicine and not going with what their buddies on TikTok.
Fair enough.
Said,
Yeah, no, we see that some of that too as well. So, that's
So when it comes to measurement, you mentioned this earlier, which is a great question. You got so many great questions when it comes to that. It shows that you've really put a lot of thought and into what you're about to do with the cream over there, and I'm so glad to hear it. Music to my ears. But look, I like to measure at the 5-hour mark. That's not written anywhere. Why? I've measured it at all time frames.
right.
I just have found that the 5-hour mark, from a clinical standpoint, is what correlates with symptomatic improvement and levels the best. Men see a level they like, their symptoms are improved, they mesh very well together, if that makes sense. Because, as I've said before, if a man sees a low number, even though he feels great, it's going to make him not feel great because he's going to let that number dictate how he
Yeah, that's
feels.
true.
If he sends a really high number, then he may fear it for some reason. So that 5 hour mark is a really good mark that correlates well with symptomatic improvement and levels that are pleasing to the patient. And I like them too. But you can measure it at whatever level that doctor wants to measure it at.
So
But I keep hearing this. Well, the cream has a 12-hour half life. No, it doesn't. It's not a 12-hour half life. There's a 25% decrement after peak absorption at about 12 hours, about 25%.
one of the things we like to do at Balance Our Hormones, and our doctors do, and I think that the logic behind it is because we want to make sure that before the next application, the patient isn't, too high or too low, and it gives them reassurance. But I do understand where you're coming from about the 5 hour mark. So we'd measure them if they're doing twice a day, at 12 hours, if we could get it to match with when the lab is open, or if they're doing once a day, close to the 24 hours within a couple hour window. But yeah, we have seen, higher levels, and obviously even with, injections, patients will say, because it goes over the range and the ranges are artificially lower and don't always take into account the person on TRT, and they'll say, "Oh, you're overdosing me," or "I'm too high." And you have to remind them, that we've seen some patients who don't qualify for a TRT who've had levels higher than that. Obviously, there's caveats where some patients will have a high SHBG to match, and that could be another story. And so it's really hard. You've got to educate them that it's not just that number and how it goes along with the reference range at the lab, because they're not always fit for purpose, these reference ranges.
Right. Well, you brought up some really wonderful points in there. Let's talk about those. So when it comes to injections, everybody was taught to measure at the trough. Well, why is that? Because they don't really want to see what the peak level is.
Yeah, that's
If you
true.
inject 200 milligrams in some men, like I said, you're going to be 3,000. Yeah, I've seen it 3 to 4,000 in a man just if you measure at peak absorption. So we're taught to measure at trough. They want to
Yeah.
see it at trough. It makes them all feel better. So they make their adjustments off a trough. With the cream, there's not really much of a trough at all.
Or is it a short window?
It's a
Yeah.
nice little sine wave of levels. And so I think it's very important that when it comes to the cream, that they understand that when it comes to measuring levels on cream, that your morning application rides on top of your evening application, or evening application rides on top of your morning application. So for me, since I do a twice daily application, I get my levels 5 hours after I apply it in the morning. Well, when I see some men come in, let's just say previously their levels were, let's just make up numbers, 1,500. That's just an easy number to always make up, 1,500, or I could do 1,000 if it makes people feel better, but let's just say it's 1,500. And then the next year I measure their labs and it comes back at 700. Well, almost every single instance, that person didn't apply their evening dose. They forgot to do their evening dose before their morning dose. Also, when it comes to the cream, understand that timing of application between applications is going to make a difference in your labs. So we always have to focus on symptomatic improvement first and foremost, not some slight variations in their lab number. Because, for instance, if we applied exactly 12 hours apart every day, if we lived in a vacuum and we could just literally do it like that and then get our labs exactly 5 hours after, you and I are going to have a number. If you and I, for whatever reason, that day we got busy and we applied it at 10 hours apart and then get up the next morning, now it's 14 hours apart because I applied it 2 hours early that evening. My number is going to be different on a piece of paper. But as you mentioned earlier, so wonderfully, that look, you got to focus on those symptoms. And even if you get a number that's lower on that piece of paper because the time between your applications was longer, you still have more than enough testosterone to saturate your androgen receptors. And what you just brought up was something that men need to truly understand. So, Mike, we all know that, and I hope this might be a little controversial topic, but it's a true topic because it leads into your statement of the androgen receptors being fully saturated. Number one, there is a saturation point to the feel-good effects of testosterone. Absolutely. I mean, there is a saturation point because once those androgen receptors are fully saturated, you can't stimulate the receptors any further. They're fully saturated. So there are no more feel-good effects past a certain point. Bodybuilders use it in really high levels because in the muscle tissue, the androgen receptors are upregulated. So you can keep building lean muscle mass by increasing your androgen levels. That's why we use multiple anabolic steroids. But as far as the feel-good effects go, they're not upregulated. So when their symptoms of a deficiency have resolved, Raising levels any further will not make you feel any better. You'll see guys on forums all the time. Man, I just feel great, but man, I don't have any symptoms. I feel great. Maybe if I raise my levels, I'll feel greater. Well, if you really think about it realistically, when does that end?
Yeah.
Great to greater. Now you're greater. Are you going to be greater? I mean,
It's just getting greedy at that point.
From a physiology standpoint, there is a plateau to the feel-good effect.
Yeah.
Okay. Many clinics, and there's nothing wrong with this. Let me make sure I explain this very specifically. Minimal effective dose. Yes, that means we'll give you a minimum amount of testosterone to raise your levels, the minimal amount to improve your symptoms. That is absolutely sound medicine. That is wonderful. That there's nothing wrong with that. But then if you ask a man, well, do you want the minimal effective dose, or is there a dose that will actually give you more benefit or the maximum benefits with regard to testosterone, with regard to increasing lean muscle mass, strength, endurance, exercise tolerance, bone mineral density, healing time, decreased, recovery time, decrease in body fat is related to a dose response as well. So the better the levels, the better the benefits. And every single man that I've ever talked to will say, well, doc, I want both. Okay, because 70% of your insulin sensitivity is related to your lean muscle mass. So the more increased lean muscle mass you get, the more decrease in your visceral body fat, which is responsible for at least 12 different cancers. So the point that I'm making is what you also mentioned that you didn't realize about studies, about the Traverse study, where we only gave men gel, raised their testosterone levels a couple hundred points. Well, some men will feel better there, but you're not going to be as good as a man that has a level maybe double that, because we're going to decrease that visceral body fat in a dose response manner. We're going to decrease the subcutaneous, visceral, we're going to increase the lean muscle mass. So every man that I asked, do you want both? They want both. And with that said, so therefore, they're running above the minimal effective dose. So like you've said previously, if they miss a dose or don't get a dose, they still were running in excess. They're not going to notice it or feel it at all when you do that. So there's little nuances with regard to clinical practice as you're seeing. And then people ask, well, when's enough enough? Well, I've said this out loud. I found that saturation point is with the free testosterone, 30 to 60 nanograms per deciliter, which is typically going to be 1,000 to 2,000 nanograms per deciliter total. And so when I start seeing, people's free testosterone levels getting 80, 90, 100, that is excessive. That's where we're starting to get into that abusive territory. So there's a testosterone dose where you, once again, minimal effective dose, low levels, and I feel a little bit better. There's that optimal level, so we're really talking about optimization. That's the optimal levels. And then there's a level when you start getting into it purely for the performance enhancement characteristics, that's when you kind of cross the line and it's no longer testosterone therapy.
Fair enough. Now, I'm just going to ask you on the free testosterone measure. We find that you can have this variability between lab to lab, especially if they're not using LC mass spec testing. The assay for free testosterone could be wildly different. We tend to use, provided you don't have a massively high SHBG or too low of an SHBG, find that the calculation of free testosterone based on SHBG, albumin, and testosterone seems to give us a good reference for free testosterone. What are your thoughts on that?
I only use LCMS for all my.
So we don't have that available in Europe.
If it's not available, you got to go with what you've got. But luckily it's available here, and I'm able to use purely a very specific, sensitive measure for free testosterone, and I base all my adjustments off of free testosterone. I don't even have to measure SHBG. I can make my adjustments off of free testosterone. But if I was in your environment, you have to adapt and you have to utilize what's available to you.
I mean, my argument for it, Keith, one, because we don't have the LC. I mean, we can do LC mass spec for estradiol, but we also will do the normal radioimmunoassay and compare the two. But they don't normally do the LC mass spec for testosterone either, so it's really hard to get the free testosterone that way. But because it's done through radioimmunoassay, and it's usually very different. So all the clinical studies that I've found, they're using the calculation, the different vermilion calculation. So I thought, well, if the clinical studies are using that, why not, based on what we have, use that one? And that should be, like I said, unless they go on the outer boundaries of too high SHBG or too low. They say in the studies that they're quite accurate.
Well, once again, that's where clinical acumen comes in. You go to someone that has experience like yourself, and this is your clinical acumen. This is what you have found that works. This is the way you measure. Like I said, you're going to measure the cream at 12 hours. That's perfectly acceptable because you're going to make your adjustments based on the levels that you're used to seeing at 12 hours. And so that's the clinical acumen. Luckily we've got LCMS here, and luckily I'm able just to follow what I need to follow to get my levels adjusted. And so we were going to, so now I guess, we hear that the cream doesn't work, and so they don't get good levels. And that's really what it comes down to is men will tell you all the time that it doesn't work, that you got to do injections to get great levels. And nothing could be further true. So about 3 weeks ago, I started taking pictures of follow-up labs. Now look, some of these labs are excessive. That's how they had to be lowered. If I would have measured, and the way I always point out, if I would have given them one injection, like the Endocrine Society recommends, once every week or 2 weeks,
Yeah.
gave them 200 milligrams, those levels are going to be in the thousands. We all know that have tested it that way, but we're not taught to measure it at its peak. So when you see these labs, understand they've got to be lowered, and they were. The whole point is that what the cream can do relative to injections in some men. If you're not careful with this cream, it can be the equivalent of injecting 300 to 600 milligrams or so of testosterone cypionate. I'll see if we can get this to work
Right.
for us.
Well, I guess we're going to show us some details of the proof of the
So this
pudding.
is just 3 weeks of follow up, and this is just to prove that the cream doesn't work, that you got to use injections to get great levels. And I get a good laugh out of this, with patients every week. So these are just over the last 3 weeks. Once again, the whole point is for all those injectors out there, all those guys on forums or that say that or bodybuilders say the cream doesn't work. It works for testosterone therapy. I'll admit, if you're going to be a bodybuilder, you got to do injections because they're at times injecting grams per week. Their levels are in the tens of thousands. But this is just cream 5 hours afterwards, and the levels are dropped. So, okay, so it doesn't work. All right, Mike. Now here's a good example. When you see a man on injection with a level of 1700, I've never really seen a free of 105. This is an example of how raising that DHT will bind SHBG and free up the testosterone. That's why you can have a level of 1700 with a free of 105. And that's not, you see what so
Oh, a second. It's
once
not.
again, see the free, pay attention to the free relative to the total. All right.
I can see that now. So that's showing.
1787, you see it?
Yep.
Okay. See that?
Free 192.
Yeah. I mean, cream doesn't work, Mike. The whole point is cream doesn't work. Cream does not.
And this is 5 hours after
This
application.
is 5 hours. You see that? Just look at the free compared to the total. I mean, you just see wonderful, wonderful free testosterone levels, even with a lower total. So I could really lower his total down and still have a wonderful, optimal free testosterone level. I mean, these are not even extreme examples. This is what you kind of see, especially utilizing this new HRT base. I'm having to admittedly lower men's levels that were on it previously as well on a different base because they're getting excellent levels just because they absorb this base so much better. But the key is you just see these wonderful totals and frees, and it just these are not made up.
Yeah.
You just
So I mean, the proof in the pudding's in the eating, right? It's and you're showing it right there that creams can work equally well to testosterone. I think it's just like we said, it's a preference that some patients have. Especially if you're going to go to daily or every other day injections, that both. And I guess there's two thoughts to that. When you have to do something daily, it does become part of your routine, but also can be easy to forget, or it can also be something that you're kind of chained to it. And that was always my fear with whether I was doing testosterone patches when I first started treatment, or doing the PLO based cream, was that everything was in that container. If I lost it, if I forgot it, I didn't have it. Where if I did my injection, and I know we addressed this earlier, but psychologically some patients may have this issue, is that there was less of a window. Like an injection probably can go a whole another week or so, 2 weeks without it psychologically, potentially with the cream, but mentally a lot of guys have a hard time getting over that. But it sounds like we've educated some men that you can do these things more frequently and maybe get a better result.
your points are all valid. It just and I'm going to say this because I say it all the time, men will get out of this what they're willing to put into it. You can work out once every week or 2 weeks, or you can work out every other day or 3 or 4. The more you're willing to put into it, the better results you're going to get out of it. So a man can take a lazy approach and say, I'm just going to jet once every 2 weeks. And if that works for him, perfectly fine. But we're trying to maximize health here. And so, yes, you could do it less frequently, but I tell men, ask them, do you brush your teeth twice? Well, yeah, I do. Well, it takes me longer to brush my teeth than it takes me to apply this. I apply my deodorant every day. This becomes such a part of your normal routine that it's just like brushing your teeth, putting on your deodorant. When I travel, it goes in my backpack. It's just like my wallet. I told a guy the other day, treat it as if your wallet. You don't go anywhere without your wallet, do you? Nope. Well, you're right, Doc. I won't. So when it becomes a part of your routine, it just becomes so easy, no different than brushing your teeth or putting on your deodorant. I think it's also important to point out with those labs, Mike, there was like 30 labs there in the past 3 weeks. Uh, Not a single man had any side effects, and more specifically, not a single man had any estrogen symptoms. Not one. I don't see those as part of my. And people will argue with us all day long. Maybe you, maybe me, my colleagues. I did a podcast with Dr. Andrew Wingy. I recommend having him on your show as well. None of us block estradiol because none of us see men with estradiol symptoms, even with those type levels. Now, of course, the levels are dropped, but we just don't see it, Mike. We just don't see it.
What is your thoughts on addition of metformin for some patients? Do you have a?
I use metformin. I send them the information on it. I think that's a completely personal choice. That's where, a patient gets to make an educated decision on if it's something that they want to utilize. And so I will send them various articles, literature on metformin as far as, looking at the TAME, the trial targeting age of metformin, the trial they're going to do with metformin, and some of the studies done with metformin. I use it personally. Okay,
Yeah,
but once
me
again,
too.
to each their own on those on things like that. Like even daily Cialis, to each their own. Yes, I use it because it protects the vascular endothelium. We see that it helps prevent major adverse cardiac events in men that are at high risk. It may even lessen the incidence of Alzheimer's disease. Looking at some of these observational studies that are coming out. So once again, even those are personal preference. But my real focus is on making sure their hormones are optimal, and all of them. All right.
If you found this video helpful, don't forget to watch our other videos on topics around HRT and TRT, and don't forget to subscribe to the channel. And until next time, stay in good health. This is Mike from Balance My Hormones.